Okay. My name is John Peterson. I'm the CEO of Habitat for Humanity of Southern Santa Barbara County. We build and repair low-income home ownership projects for families in our community. We're about building strength, stability, and self-reliance through shelter. And when I think about a healthy community, we believe strongly that housing and particularly home ownership are key to family success and changing the future of a family forever, whether it's coming out of poverty or improving education or just improving health. We see a lot of difficult situations that families are living in, unhealthy situations, from just purely unhealthy like sewage and other things in their homes to overcrowded places and other things where kids aren't able to study or spend the time that they need. And so we really see that base and foundation of good housing is key to population.
Thank you.
Hi, my name is Ben Romo. I'm the Executive Director of First Five, Santa Barbara County. First Five gets sales taxes from cigarettes and then we distribute those to programs that serve 0 to 5-year-olds to get them ready for kindergarten. Invest in family support through social service agencies that are providing case management, parent education, basic needs support for parents and children, parents of 0 to 5-year-olds and children in that age range. And we also work to improve and increase the access to, improve the quality of and increase the access to preschool and child care. When I think about population health in the 0 to 5 world, because it's the beginning of life, we think of our area of investment and activity as a great preventative strategy. And if we are able to support families and children with the access to services that they really need, especially those who are the large chunk of families who are in poverty, then we would be starting our families not only toward kindergarten readiness, which is what we are concerned with, but toward a much more healthy and stable and productive life where they're reaching their true potential. So healthcare and health services and healthy families is a key component to kindergarten readiness, so we're very interested in it and invest in strategies to support that as well.
Thank you.
Hi everybody, I'm Jared Schwartz. I'm the Executive Director of Just Communities. We work to really ensure promote social justice in all forms and more equitable schools, organizations, and communities throughout the Tri-County area. I think my idea of a healthy community would take a very long time to talk about. So what I'll just say is that what we really focus on is making sure that there aren't disparities based on race, ethnicity, gender, sexual orientation, socioeconomics, language, in whatever access to health and outcomes in health.
Thank you.
Hello everyone, my name is Steve Ortiz. I'm the Executive Vice President for United Way of Santa Barbara County. Recently appointed incoming CEO for United Way of Santa Barbara County in the first quarter of 2017. What we do at United Way, we either create, lead, and partner with organizations to deliver programming focusing on education, financial development, and health. One of our biggest movements right now has been focused on literacy, getting students to really improve their scores in that area. We see a big issue locally and nationally with literacy, so partnering with different schools. We have 35 different partnerships in the school setting, and prison systems as well, as people are getting out of that system. And even organizations who are looking to improve that area. And really our goal is to build better futures for the individuals in our community, and with a variety of partners and programs we're able to achieve that together.
Thank you.
Hello everyone, my name is Colette Shabram. I am the Executive Director of Pacific Pride Foundation. Pacific Pride Foundation is this county's LGBTQ+ resource center. We have offices in Santa Barbara and in Santa Maria, and we are celebrating our 40th year as an agency here. So we have a lot of projects that we do, and one of the main reasons I think that I'm at this table is because of all of the work that we do in our HIV/AIDS realm. So we have a health utility vehicle as a mobile testing unit, and also an exchange clinic for our syringe exchange. And I think when I look at kind of a global picture of the county and health and that, the word that pops up into my head is equity, because that is one of the things that Pacific Pride Foundation is fighting for within LGBTQ+ communities. So that was what I would like to see.
My name is Liliana Hernandez. I'm a healthy relationships educator for Family Service Agency. Some of the 5 main programs that we have is our Big Brothers Big Sisters mentorship program. We also have counseling services, which we have a counseling center at a sliding fee scale for the community, children, youth. We also have senior services, which also includes our ombudsman program, which is something very recent where we go and make sure that licensings are up to date and people are being provided services adequately. Particularly, I work for the Family Support Services program, and so we do educational programs. We do parenting classes, healthy marriage and relationship classes, information and referral services. We have offices in Lompoc and as well as Santa Barbara. We also have social workers, school-based counselors, intensive in-home services. So pretty much we provide a lot of services here for our community.
I'm sorry, and so a healthy community looks like for you?
A healthy community would be just minimizing as many challenges to access services in the community. So really just focusing on making sure they have all their basic needs, which would be housing, healthcare, and all those things.
Great, thank you.
My name is Candy Garcia. I'm also with the Family Service Agency, and I'm also one of the parent educators. I teach the Healthy Relationship course and the Nurturing Parenting course, and I'm also going into the high school, Santa High School, and working very collaboratively with the teen moms and seeing what their needs are. I'm also working on the Welcome Every Baby visits and doing the home visits with the new moms. What a healthy community looks like to me is considering the family at all times and seeing what they need and how we can support them in making sure that they have a successful future for their family.
Thank you.
I'm Bev Milkman, and I'm the president of the Santa Barbara Meals on Wheels board. I'm a volunteer. I think I'm like some of you here, although you probably put in enough hours that you feel like you're volunteering to do. Santa Barbara Meals on Wheels has been around for over 40 years. We deliver meals primarily to elderly people who just are unable, probably because of age or some sort of infirmity, to be able to go out and shop and prepare for themselves. We do it through volunteers. We have a team of around 100 who drive, go interview people who are interested. We do have a website now, which is something new for us, so we're getting some referrals through that. We get referrals through social services. We get referrals from Cottage Hospital when people are discharged. We deliver meals 365 days a year. They are freshly prepared at Valverde Retirement Community. At any given time, we are serving between 110 and 150 individuals. Sometimes it's a husband and wife. As I said, the vast majority are seniors, but if someone has a disability and is unable to do this, we will serve them as well. And we have a sliding scale. We estimate that the majority of our clients are low income because of where they live, and so we are able to reduce our charges, and we do subsidize the price of every meal. To me, a healthy community, I would agree with what you said, and that is it's a place where everyone has access to the basic needs of housing, healthcare, food.
Great, thank you.
Good morning. My name is Rick Polino. I'm the Director of Resident Services and Neighborhood Development for People's Self-Help Housing. We have housing in 3 counties. We have 47 projects. About half of them are in Santa Barbara County. And we also build self-help homes. We help people build their own home, and we have about 1,200 of those on the Central Coast. I oversee the Resident Services Department, which we have education programs, a clinical supportive housing program, and a community building program that we have for all of our residents in our rental housing. A healthy community, to me, is seeing our residents become self-sufficient and be able to move on from our housing.
Thank you.
Good morning. My name is Brianna Casas, and I'm with the New Beginnings Counseling Center Safe Parking Program. We're unique in the fact that we provide shelters for the vehicular homeless here in Santa Barbara and in Goleta. We serve roughly 130 clients at a time, but that's not to discredit the 50 families and individuals that are on our wait list. We try to just increase access to different services for the families and, ensure that they have housing, ideally. Let's see. I guess a healthy population to me means affordability, first and foremost, accessibility, and also ensuring the social well-being of individuals, because without social well-being, you cannot have physical well-being.
Thank you.
My name is Diane Martinez, and I am the Director of Immigrant Hope Santa Barbara, and we are a accredited immigration legal center. We do English learning, civics and government tutoring. We do a driver's license study course, and we do community education courses. For me, a healthy community is obviously just and fair immigration laws, but fair and equitable jobs that are offered to all, as well as community education is very important to me, so that those that even are at a poverty level are able to understand how they can utilize what they do have to raise their families better.
Hi, I'm Chuck Flax. I'm the Executive Director of C3H, which is the Central Coast Collaborative on Homelessness. And our mission statement is to harness all available resources to end homelessness and reduce its impacts on communities across Santa Barbara County. What that means in practice is we are collaborating with agencies across the board, including healthcare, law enforcement, the business community, government agencies, to try to find solutions and not just Band-Aid treatments, but really try to end homelessness as a crisis here in our community. So it's an interesting question because I think some of the answers are very general about equity and support and increasing access, and all those things are really important. I think in Santa Barbara specifically, we have a crisis in housing at every income level. So people who, the current director of or soon-to-be director of the Housing Authority lives in Ventura. The director of the Chamber of Commerce for Santa Barbara lives in Oxnard. We have housing they can't fill the police force because they can't hire enough cops who would live here in Santa Barbara. That is a significant crisis. I don't know if Cottage can do anything about it. The other issue that I have heard repeatedly is mental health, and this is not just for the poor or county provided mental health, but across the board. There's a shortage of psychiatrists, a shortage of practitioners, a broad acceptance of mental health as a key component to overall healthcare outcomes. And both of those impact the homeless very specifically as well.
Hi everyone, my name is Adalia Gomez and I work at Santa Barbara Rape Crisis Center. I'm the program director there. And the services that we provide are directly for survivors of sexual assault and their significant others through crisis intervention programs as well as long-term counseling. And we also provide education to the community. That's to provide awareness about the issue, about our services, and also we do rape prevention, education, and risk reduction. Health. Survivors of sexual assault have a lot of health impacts in their lives. We see the emotional, the mental health, and their physical health, not only right after a sexual assault, but also in the long term. Our mission is to end sexual assault because we do know that would improve the lives of many people.
I'm Maria Fisk. I'm the Executive Director of the Carpinteria Children's Project. We aim to help all children be prepared for kindergarten, and we understand that that really means working with the whole community as children are growing up in their families and families in their communities. So we focus on all those things by providing early childhood education, a family resource center funded by First Five in part, parent classes, and we also coordinate networks of other early childhood education providers and health and social service providers so that we collectively can have the most impact in the community. To me, a healthy community understands the multifaceted social determinants of health and all the things that go into a healthy community and works to integrate services provided so that they can be more seamless and more coherent for families.
Thank you. So It's always, by the way, wonderful to sit in a room of people who every day wake up to try to improve the lives of others. So, thank you for the honor of actually being able to sort of be here and connecting with you each